A year ago, December 17th, I had a knock on my door. It was our local police officer. We have one police officer in a little town. He said, "We've been trying to call you, but we haven't been able to reach you. You need to get to the hospital immediately. Your daughter is in in critical condition, and we don't know if we're going to be able to keep her alive long enough for you to get there." And I said, "What's happened?" And they said that she had been strangled with a hairdryer cord. She was found unconscious. Her heart had stopped beating. They began to resuscitate her, and of course the protocol typically is to try 4 attempts and then call it. But they tried a 5th attempt and got her heart back. Got her back. Took her to the hospital. When I got there, she was on a cooling blanket, which is part of their protocol to preserve the brain. It is to cool the body down to 92 degrees. I wasn't aware of even the hormone therapy that they use for ischemic injuries, or the possibility that it could be used for hypoxic or anoxic injuries. And so I learned later what could have been done, which is another insult to the community, is that this hormone treatment would reduce the injury from somewhere from between 50 and 80%. That therapy was not used, and she was in a coma. They had determined that her brainwave pattern was between 2.5 and 6 on a Glasgow scale. Glasgow scale being somewhere between 0 and 11 determines how much brain function you have. Basically, she was at a Glasgow of 2.5, and between you and me, that is equal to about a tree stump. I was given the information that she was never going to be functional again, and actually have a letter in writing from the director at Big Baylor in Dallas that said she will never have any kind of meaningful recovery, that she would never be beyond vegetative. Okay, so she was not at that point interacting with the outside world or environment. She did open her eyes, and she would lay with her eyes open. She was on a respirator, breathing machine. She was on feeding machines. She was on telemetry to monitor her. She was on a myriad of medications, including 2 beta blockers to manage her pulse and blood pressure. Her brain was not doing the job, and they were using a myriad of drugs, constantly changing them to keep her systems moving, because I refused to pull the plug. I learned that their standard protocol is to pull the plug. Talk the parent, take the parents into a little room in the little hospital chapel, and the very dignified doctor sits down and tells you, "This is the end, and this is never going to get better, and your daughter's going to expire. What we would like you to do is we would like you to allow us to make her very comfortable, and then we will ask you to pull the feeding tube." They're asking me to take my own daughter's life. I was insulted. My wife was in shock, and I said, "This can't be the end." And so I researched. What I found was documentation. You can go out to NIV.gov and find the same documentation, which says over 10 years of studying somebody at this level of injury, that there is 0 chance of recovery. This was documented and backed up by a myriad of other doctors with papers supporting this finding, and that there were only 2 ways, only 2, that you would ever be able to see recovery. Clearly in this documentation it says stem cell transplant or tissue transplant. However, the caveat is that it would be anywhere from 20 to 30 years before this technology will be available. I put in stem cell technology, and I put in stem cell, and it popped up all over the internet. However, all of it was overseas. So I began talking to people and interviewing people. Here's what I learned. The scientists doing the work will actually answer your emails, pick up the phone, and talk to you. The medical doctors, practitioners will not. They will not have a discussion with you. It's all, "Oh no, sir, we don't support that." So it's a little bit insulting to be an American and find out that I probably shouldn't say this, but the President of the United States has set us back a decade or a decade and a half behind the rest of the world in this technology, and that there are a few doctors in this country that are bold enough or brave enough or willing enough to do the work to help people here. Okay? That said, my wife on the internet discovered Dr. Rader. Every research out there supported what Dr. Rader was doing. Every trial in the other part of the world supports this work and says that it's viable and real. And we said, we're going to try it. And so we contacted Dr. Rader. As she got the treatment, came back, got on the bus, and we were about 14 hours or 16 hours into the trip home, she started doing this with her leg. Like you can't get comfortable. I woke her mother up and I said, she's moving her leg around. And she said, what? She does this with this leg. And her mother goes, no, she's moving her right leg. I said, no, she's moving her left leg. No, she's moving both legs. Well, I can tell you that my daughter's no longer vegetative and she's continuing to recover. We now are having a wheelchair made so that she can be up most of the time, because guess what? She likes musicals. Audrey Hepburn is her hero. She watches TV. She is becoming active with her environment. What can I say?